You'd think that after decades of medical advances, after injectables that shrink waistlines, after public health programs and government campaigns, the world's waistline would be shrinking. Instead, the tide of obesity is still rising. Right now, more than 1 billion people are living with obesity globally, and forecasts warn that by 2050, over half of all adults and 1/3 of all children could be overweight or obese. The paradox is this: we have better medicine than ever, yet the epidemic keeps accelerating. What's going on? Let's rewind. Obesity used to be seen as a problem of affluence. Richer nations, more food, bigger bodies. But over the past 4 decades, the story has changed. Obesity rates have tripled since 1975. Low and middle-income countries now carry the heaviest burdens. Urbanization, the proliferation of ultra-processed foods, sedentary jobs, screen-time lifestyles have combined into what researchers call obesogenic environments. The food we eat, the places we live, the jobs we hold, all of them are now stacked against healthy weight. Put simply, the world has changed faster than the individual can adapt. Medicine, however, has kept pace. In theory, we've developed better drugs to treat diabetes, to help with appetite control, to manage cardiovascular risks. Clinics now recognize obesity not just as a cosmetic issue, but as a chronic disease. But despite that shift, the numbers don't budge. Why? Because medicine treats the person, but the weight gain epidemic treats the placeness, the society, the food system, the built environment. In a world drunk on cheap calories and mechanized lives, even the best medicine is a plug and a leak. Firstly, let's examine the data. In 2024, studies confirmed that over 1 billion people worldwide were obese. If trends continue, one large projection warns that 60% of all adults and 33% of children will be overweight or obese by 2050. That would shatter healthcare systems, collapse productivity, and reverse decades of public health progress. The crisis isn't only medical, it's economic, social, fiscal. Obesity already costs nations about 2% to 3% of global GDP in direct and indirect expenses. Without urgent action, that burden will soar. Why isn't the medicine turning the tide? Because the tools are necessary but not sufficient. Drugs can help individual patients. Surgery can transform lives. But you can't drug your way out of a society that feeds itself on sugar, pumps itself with screens, and designs cities with cars instead of footsteps. When the system is built to circulate overweight, medicine becomes the fire extinguisher for a building that's still designed to burn. One key reason: the nature of obesity is far more complex than eat less, move more. Hormones, gut microbiomes, genetic programming, early life nutrition, and even sleep and stress all play a part. That means interventions have to be deeper than diets or gyms. They need to address how we live, how we work, how we commute, how we eat. Treating obesity as a medical problem without tackling the environment is like trying to cure flooding by asking each homeowner to buy a bucket. Another reason is inequality. The food system is skewed. Ultra-processed foods, high in sugar, salt, and cheap fats dominate the global diet. They're marketed aggressively and priced to sell. Meanwhile, fresh fruits, vegetables, lean proteins are often more expensive and less accessible, especially in low-income communities. Sedentary jobs dominate, green spaces recede, screen time rules. As research shows, lower-income populations bear the worst increases in obesity because the environment offers cheap calories and minimal opportunities for movement. Medicine doesn't change that overnight. Then there's the business of food and the economy of weight. The global market values cheap, addictive, engineered foods. Governments raise taxes, enact labels, encourage activity, but these policies struggle against food industry marketing, government inertia, and cultural norms. In many cases, policy approaches lag behind how quickly the food system evolves. Meanwhile, better medicine often means better profits. Weight loss drugs, Bariatric surgery, chronic disease management generate vast revenue. The irony is stark. While individuals pay for the medicine, systems profit from the disease. We also face the problem of timing. Public health efforts often come years after the environment shifts. Urbanization begins, diets westernize, sedentary jobs spread, and only then do interventions follow. By the time medicine catches up, the burden has grown deep. Once fat cells expand, once metabolic systems recalibrate, the body becomes resistant to change. Prevention would have been cheaper and easier. But that ship has sailed in many places. Yet medicine does matter, and its growing power is visible. We now see drugs that can reduce body weight by 15 to 20%. Metabolic surgeries that can reverse diabetes. Clinical models reframing obesity as a disease, not a choice. In some countries, we have looked at slight declines in bariatric-eligible populations. But again, the medical revolution hasn't reversed the societal trend. It's simply offering relief where prevention failed. So what must change for the global obesity crisis to bend rather than break? 3 big shifts: environment, equity, and agenda. Environment, city planning, food systems, workplaces must become weight-aware. That doesn't mean everyone runs marathons. It means walking should be built into life. Real food should be affordable. Screen time should be balanced. Kids should live in spaces that invite movement. The default must be activity, not sitting. The default diet must be nutritious, not engineered calories. Equity. Access to healthy weight should become a human right. Food deserts must vanish. Subsidies should favor fruits and vegetables, not sugar-drenched snacks. Healthcare systems should treat obesity proactively, not wait for complications. If this deep dive helped you understand why the crisis is worsening despite our best treatments, hit like, subscribe for more health science breakdowns, and share this video with someone who cares about the future of global health.